Hi, we're going to talk some more about patient experience. And today I want to focus on the appointment or the stay and when patients arrive and through that visit. So the first thing when I was teaching the eye care classes, those of you in TCOT and then the registrars that I taught for the hospital, you are the first impression of our organizations, whether it be your clinic or the hospital. You are the front line, and thank you for being that. Sometimes that's a tough place to be. I want to remind you to always smile, make eye contact, acknowledge people right when they come through the door. Even if you're busy, you can say, "Hi, I'll be right with you." And then when they come to you for their registration process, introduce yourself. Please don't forget that. Tell them your name, tell them your role, and tell them what you're going to be doing, how you're going to be helping them. And then the sometimes difficult part is tell them if your clinic or surgical services or the ED are running behind. We know that happens in our clinics, and it's okay. People just want to be informed. Their time is valuable. They deserve to know how far we're running behind. It gives them the opportunity to either reschedule or to make other arrangements to play on their phone, especially in surgery. It also lets them know how long they're going to have to be awake and wait because they haven't been able to eat since midnight. And it's just a way for us to show respect and that they are valuable and that we realize their time is valuable, so we want to give them that opportunity immediately. So please welcome these patients with your beautiful smiles, a great attitude. Be honest and upfront. Get that information. You have a good idea how far things are running behind, but if you're unsure, go check. Ask a question from those in the back, especially in the emergency department and surgery. It may be a little trickier. For those of you in the emergency department, it's important that you explain the triage policy and how things work. It is very frustrating for patients to see somebody come in after them. You may know that they are sicker than somebody else, but they don't understand your triage process. So make sure you're updating people on that and continually update people while they're waiting in your waiting room. And then to the next step, to the nurses, whether you're greeting somebody onto the floor or if you're taking them back to see the physician, again, introduce yourself and then explain the next steps. Explain to them each step along the way. We're going to get your weight and blood pressure. We're going to update your medications in Epic. We're going to get you ready for surgery. We're going to get you changed. All of the things that you do, there's always a next step. And we should always be informing people of what's going to happen next. Educating them, it brings them comfort. They know what to expect, and they feel like they're in good hands. And we should always, when given the opportunity, to sit with our patients. The MAs, nurses, take a minute. Sit down and give these people your undivided attention. And goodness knows, I know you're busy. And I know that the emergency department, that doesn't always allow you that. But we have gotten you rolling stools, and those of you on the floor, there are those great chairs that hang behind the doors. The clinics have stools. Sit down. Talk to these people. You are very, very smart people. You can give them a few seconds of your undivided attention before you start typing away into Epic, because I know you've got a lot to document. And then prepare them for the physician, and our physicians are going to be required to do the same things. We're going to ask you to sit and listen and give people your undivided attention. And then as you do things with these people, please ask them permission. Can I prepare you for your injection? Can I give you these clothes to change into? And then explain why. I always talk about at Imaging Plus, they ask you to change into scrubs, and most people don't understand. It's to ensure that there's no metal on your clothing. Explain to people while you're doing things. You learned about COLA during eye care, caring out loud always. If you touch it, talk about it. That is something you should be practicing every day. But again, welcome people with a smile and open, good body language. Introduce yourself, explain next steps, set the stage of their visit, tell them what to expect, give them time frames. CT is running behind. We have somebody in the scanner. You will be next in line. That may be 30 minutes. And then if a trauma came in and you're in the ED, go back to them and say, look, we've had another trauma. I'm so sorry, but we're going to delay your CT for a more urgent care. So these are all ways we can help. You have a great day, and I hope this helps you with your next patient.